Imagine you or a loved one has congestive heart failure and you've been treated for several years, and despite being on maximum medications, your condition only gets worse. Every day you have severe chest pain, shortness of breath at rest and with mild exertion. You were told that you needed a heart transplant 2 years ago. I'm Dr. Baxter Montgomery, and I saw exactly a patient with these presentations. I'm going to share with you what we did next. So the question with this patient was he sick or was he thirsty? And here's our approach to manage a patient with severe heart failure. He was a 57-year-old man. He had worsening symptoms of heart failure, such as chest discomfort, swelling in his abdomen. He was short of breath. He had chest pain at rest and with exertion. His stomach was swelling. And these conditions were worsening despite the fact that his medications were essentially maximized. Essentially, he also had type 2 diabetes, he had prior stroke, and he had high cholesterol. So he was a complex patient. What did we find when we evaluated this patient? His heart was only pumping at 20%, with normal heart function being 55% or greater. He had kidney function that his filtering rate was only at a 14. This was so severe that he qualified for dialysis. When we repeated the labs after a week, it had decreased to 4. And his inflammation in his blood was severely increased. And he was taking 11 medications that were all at maximum dose. So what was our approach? What did we do next? Well, the issue with this patient was he severely ill, or was it a simple underlying problem? And could that simple underlying problem be dehydration? Well, here's what we did. We admitted him to a local hospital where I had privileges, and we started an aggressive approach of hydration. We hydrated him through the veins. We started an IV and gave him intravenous hydration. But in addition to that, we also started him on a hydrating nutritional diet. So in the hospital, we fed him raw hydrating fruits and vegetables, as well as smoothies. We also gave him some cold pressed juices. In addition to that, we began to rapidly wean his medications as his blood pressure improved and as his overall condition improved. So our simple approach was IV hydration, a plant-based nutritional hydration, and medication weaning. So this simple 3-pronged approach to this patient with a potentially life-threatening illness led to the following outcomes. First of all, the kidney function rapidly improved. Within a week, the kidney function improved by more than 6 or 7-fold, and after that, it doubled, just simply with hydration and medication weaning. The heart function improved by 20%, from going from a pumping function of 20% to one of 25%. Now, this doesn't seem like very much, but there's a very significant improvement in circulation, such that it improved the function of his kidneys in addition to the hydration, and also it was enough to help suppress all of his symptoms. We were able to reduce his medication from 11 medications down to 2. This was very important because many of the medications that he was taking were diuretics and also medications that were harmful to the kidneys. So the medications were contributing to the severity of his illness. And so the fact that we were able to wean the medications and reduce the medications also contributed to his overall well-being. So what other conditions can lead to or be secondary to dehydration? Well, hypertension, a common ailment that everyday individuals have. Many individuals we see with high blood pressure, is because of dehydration, and many of the medications used to treat hypertension can contribute to that dehydration. Constipation, chronic fatigue, arthritis, headaches, and many more chronic illnesses are underscored by dehydration. So many individuals that we see in our center, they're not essentially sick, but rather they're thirsty. So what can you do about this common condition, and how can you prevent dehydration? Many of us are too busy in our days. We talk about drinking lots of water, et cetera, but it's something that it just doesn't happen. So we recommend that you start your morning with hydration. Just like you take a shower in the morning externally, you should take a shower in the morning internally. What does that mean? You must be ready to drink fresh filtered water, alkaline water, double osmosis water, coconut water that's unprocessed, either gotten straight from the coconut or bottled straight from the coconut, is one of my favorites. Cold pressed juices, another one of my favorites. You want to mix fruits and veggies together. Some people question that, but that's been very effective in our practice. Smoothies that are healthy smoothies. Also, hydrating fruits and veggies. So if you start your morning off with hydrating foods, you'll find that your body is hydrated from the beginning of the day. And this enhances your energy level, enhances your overall body function, and it leads to hydration early in the day that helps you throughout the day. And so you don't have to rely on remembering to hydrate throughout the day if your body starts off with adequate hydration. So remember, the next time you have a headache, or the next time you are diagnosed with a condition such as high blood pressure, ask yourself the question, am I sick or am I thirsty? I hope this was helpful to you. And if you're new to the channel, please hit the subscribe button. Please hit the thumbs up button and share this video with many individuals, because I think it'll be very important for them to learn these simple facts and simple steps that you can take to optimize your health in a way that can turn your life around, as what happened with this gentleman. Take care to the next video.